and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and joined by my co-host, Vivian Hudson. Viv, we got a special guest today.
Woohoo! You've always got some surprises for me, so who have we got, Mike?
Yep, today we have on Brooks Anderson from Abilify Labs, and Brooks had come to me just recently, actually, with a interesting proposition with an untapped opportunity for, especially for the private practice doctor, and I thought it was very interesting the way that they were positioning one of their lab tests. So, Brooks, I want to thank you for getting on today.
Well, my pleasure. I'm excited to have this opportunity, and good to meet both you too.
So, Brooks, we're going to speak about today is a specific lab test for nail fungus. I know that doesn't sound like the sexiest of topics, but we're in a climate right now where we talk about all the time on this podcast, Brooks, that physicians, especially the private practice physicians, are under constant strain. They got their Medicare pay increase for 2017 turned into a pay decrease after the fine print, and so just the pressure is mounting on the independent physician to find additional sources of revenue. And so that's what we try to help physicians do. And this is something that I was unaware of. So I was very interested to hear about how you guys are positioning this. So first and foremost, can you tell me what the test is that you're offering and what it does?
Absolutely, and thank you. Ability Diagnostics is what we've tried to do with this lab specifically is structured looking for niche opportunities. As you said, toenail fungus is not necessarily the most sexy of all those out there, but it is a growing concern. And unfortunately, the older we get, the more susceptible we are to the disease, not necessarily because we're getting older, but just because we're exposed to it more. It embarrasses the patient. They don't want to go swimming. They don't want to go out where they might be seen. They don't want to wear open-toed shoes or flip-flops and so forth. And so it has those issues. The other thing is, our feet live together, our left foot and our right foot, and sometimes it shows up on one foot and not the other. On top of that, they're under the covers with other people and sometimes in the showers or other places. And so it is something that can be transmitted to other people. And so it would be nice if we could take care of it. So that's kind of what we're looking at, growing concern, and certainly interesting for the doctors to help treat their patients.
I'm a little bit ignorant about it, though. This is different than athlete's foot, right?
Yes, it is.
Okay.
So what's the differential diagnosis? So if people are having problems with their toenails, what else could it be?
Well, it could be a number of things. It could be an injured toe. It could be, a cancer, or it could actually be toenail fungus. And the actual term, the medical term for toenail fungus is onychomycosis. And it's usually one of three conditions that cause it, and I'll call them pathogens. One is fungus, one is yeast, and one is mold, and they're treated differently.
No, those sound
right.
Good.
Yeah, and I know it is quite a difficult condition to treat because it's got to be treated for such a long time. But back in my pharmacy days in Australia, I do remember seeing a lot of people with it, and I'd often comment when I saw people with the condition. And I actually had a guy, he said, I've just been in hospital for like a week. I was so embarrassed to show my feet to people. And he just actually thanked me for bringing it to his attention and letting him know that there was something that could be done about it. So it is a very common problem, and patients will thank their doctors if they actually do this test. So from what I understand, there's an opportunity for the doctor to get some revenue on this. So can you tell us a little bit about how that works?
Yeah, absolutely. In cases of doctors who treat patients with these conditions, there's two ways to diagnose it. One is visually by themselves, and again, we're risking circumstances that present in a way that looks like it's onychomycosis when it in fact might not be. And we're actually starting to hear of situations where some of the payers, particularly Medicare, is coming back and asking doctors for proof of diagnosis. So the second way that they can diagnose this is by actually capturing a biopsy and sending it to a lab that has the ability to provide them with proof of diagnosis. And that's what we do. So to answer your question, Vivian, is the doctor, by extracting this specimen and sending it to us, actually fits into a position where they can bill the payer for the professional component of collecting that or excising that specimen and sending it to us. And the typical code that people bill off of is 11755. And in a bilateral scenario, they could see as much as $150 to $160. In a unilateral, somewhere around about 100 to 110, depending on where they are and the payer, so forth.
Do they get to bill for a high complexity visit then too? Is there any upgrade on is it 92114? I think is a high complexity visit, or is it?
Mike, I typically leave that up to the doctor. Certainly, when the patient comes in today for a visit, there's the applicable visits there, but the patient's going to have to come back at a later date once the report is generated. And by the way, our lab turns this report around in about 3 days. So once the doctor collects the specimen, we give them a overnight shipping label to deliver it directly to our lab. We would have it the next day, and within 3 days from there, they would have a report. It's a color report that allows them to make the judgment on how to treat the patient for the highest probability of the outcome they want. But that second visit might generate the complexity that you're asking about.
Yeah,
with the code, I've just looked it up, and the national payment amount for it is $135.30. So how long does it take for the physician to actually do the biopsy?
Well, that's a great question. And by the way, this is not just a toenail clipping. For us to get the highest results, the best results, the highest quality results, I would put it, the doctor really needs to collect the biopsy that is into the fold or into the nail bed a little bit. So we do actually have quality tissue, and we need about 2 centimeters by 3 centimeters in size. And the time to collect that is about 2 to 3 minutes. And it would be best if we had a bilateral specimen, but that's up to the doctor. If they feel a unilateral is enough, then that's fine too.
So if they do a bilateral, can they bill that code twice?
Yes, but on the professional side, I think most insurance payers only pay one and a half times for a bilateral versus just one time for a unilateral.
Okay, well, that's still not bad.
Right, yeah. No, I mean, you're presenting some opportunities here, and this dovetails with a lot of the other tests, newer lab tests that we've been promoting, Viv, where they have the benefit of getting right to the point, finding out, giving the doctor some real ammo, some objective data that they can use, so they're not guessing on what the patient has. They know for a fact this is what the patient has, and this is the best course of treatment. So it's just better patient care all around. How is the test actually performed, though? Is this a molecular test? Is it like a cytology, or what? How are you actually identifying the specific pathogen?
There are 3 primary ways that it can be done. One would be molecular, as you described, using a PCR. The second one would actually be done by staining the actual specimen with different types of stains that present the dermatophyte in a way that the pathologist can identify it. And then the third way is to actually grow a culture. The latter is the most difficult to get the most accurate because of cross-contamination and so forth, and then obviously it takes 3 or 4 weeks. Right now, our lab is a histopathology lab, and our pathologist is a dermatopathologist with years and years and years of experience, over 1 million slides that he's read, a fellow. And he's very experienced at this, and so our turnaround is really quick. I will tell you also, we were instrumental in one of the larger labs out there in identifying the 30 primary pathogens that contribute to this, this disease. And we're in the process of acquiring and putting in our own PCR equipment. So we will be doing molecular testing as well here in the next few months.
Yeah, that's exciting. I've heard a lot of rumblings about that because we've been involved with PCR testing. It's great technology. I bet you 90% of the people who are listening to this podcast are very familiar with it or are currently promoting it for the respiratory and GI. And I've heard from, I know someone at Thermo Fisher who's told me they're working on something for fungus, toe fungus, as well as wound. And so this is really exciting, especially with the professional component for the doctor. This is a home run. How prevalent is toenail fungus, though? Is it your typical primary care provider who's seeing 100 patients a week, 20 patients a day? I know you probably don't have any hard data to back this up, but anecdotally, what would you think what would you see out of that? Expect to see out of that physician?
Well, that's a great question. By the way, primary care physicians have a tendency to refer these kinds of patients on to podiatrists or other specialists. And there is no reason that a primary physician shouldn't be treating these patients and going through the diagnostic measures. In a primary care physician setting, depending on the cross of their patient population, I'm hearing them talk on seeing 1 to 5 a day that are presenting with onychomycosis or symptoms of such. In terms of a podiatrist, that number can easily double.
And obviously this can work on fingernails as well. So I know a lot of women go and get their nails done at the salon, or they use fake nails and they end up with these kind of conditions on their fingernails. So is that something that they can use this code on fingernails as well?
Absolutely.
Yeah, excellent. But I would concur that it is pretty common, Mike. Like I would say that the figures that Brooks said as far as the prevalence is definitely, it would be up there, like in the up to 25% of the population can have it. So you might think it's just a little.
That's not my world.
A little.
Viv, you've been here to California. In fact, we went to the beach together. You saw how pristine my feet are. So this is not my world. But
unfortunately, I didn't take any photos for show and tell. But
don't worry, I got a whole photo album. I'll share it with you. All right, Brooks, what does the reimbursements look like from the lab side? What are you seeing from Medicare, and what would be the range for your commercial payers, and what is the acceptance from the commercial payers? Do you get a high adjudication?
Yeah, we do. Medicare, we're seeing 95% adjudicated. On commercial payers, we're really not seeing much of a difference. They're up there and pretty good. It's a well-established, well-known condition, and so it's not like they're trying to find ways to exclude it. But in terms of Medicare, and I'll speak specifically to it. We're actually seeing an adjudicated amount between $350 and $550.
That's pretty solid. Well, Brooks, this is great information. I think a lot of your independent private practice physicians are going to be very interested about this, and I think it's just a matter. I had no idea that there was a collection code for them and to do biopsies like that, or that they even performed biopsies on nail fungus or on toenails. So this is exciting. I appreciate you getting on. And everyone listening, if you have any interest in this at all, if you want to promote this to your private practice doctors, please get in touch with Viv and I. We have all the information to get your physician started, and it's also on the Lab Match Matrix. If you don't have the Lab Match Matrix, please reach out to us. We can forward that to you, and you can see which states and which insurance companies this is available with. Brooks, thanks again for getting on.
Hey, my pleasure. Thank you for the opportunity to speak. It's been a lot of fun.
You can climb a mountain, you can swim the sea.